have a first injury to a joint like that or a first bad ankle sprain, it's always going to take a lot longer because you're not just fighting the injury, you're fighting the body's response to the injury. And the first time the ligaments are torn, there's a huge swelling and pain response.
When you've watched him lately, does he look healthy to you?
That's a tough question because, you know, he was on the field for 32 snaps in that NFC Championship game and he touched the ball 4 times. So really tough for me to say exactly how he looks. We know he's resting. We know since December he's been having some issues with inflammation in that knee. And that's the knee that he had the ACL reconstruction on in college. So I think that's something, you know, to keep an eye on. I really don't expect to see him go back to his normal full snap count. I think he'll be splitting time with C.J. Anderson for sure. It's all presented as fact in this textbook, this beautiful textbook. And the question is, are they really facts? It's like by the end, you don't know what's fact and what isn't.
Is that what you're talking about with the joint issue? Just give me more on that, Jessica.
You know, a ligament issue in that joint could be a really tough thing for a quarterback. We saw it with Jacoby Brissett. It makes gripping the football more difficult, and therefore it can really affect ball security. You know, an injury like this early in the season can come back to haunt you later in the year, so I think they'll probably take their time letting him come back. The back and the Achilles didn't surprise me. I mean, I think the back is the bigger issue now. The nice thing is he's had 2 weeks, and I think we're going to get a pretty good performance out of Gronk today.
Yeah, I was really glad that they retracted the article. I mean, I think there were a lot of systemic flaws with how they designed the study. Specifically, as a female doctor, it was concerning to me that a bunch of male doctors were asked to judge the appropriateness of how female doctors were dressed. So I was definitely glad to see it retracted.
I hate to say this, but I think Hightower's done for the season. I think he'll be great by next season, but we're not going to see him again, even in the postseason. It did look like it could be a fractured hand, but it sounds like the x-rays are fine. So I think he's dealing with a bruise on his hand, and I expect to see him playing this weekend. I always try to go back to the video, and I looked at the video and said, was there anything that I saw that made me worried about a different injury? And I didn't. Things to keep in mind with him are, yes, he's at increased risk of refracturing, but not at the place where his previous fracture was. It's really more at the end of the plates that are holding the fracture together. If this is just plain old stitches, I'm not concerned at all. You know, I think he'll have a pretty typical game. He's coming back from a tough injury. It's very likely he could have another setback, but I would expect him to be significantly limited. It was a really weird injury. He didn't really seem to do any kind of quick change of direction or really strain that groin. All of a sudden, the leg just went dead. It says basically this is not based on any data, and yet they have an X and a Y axis with actual numbers. So it's just frustrating to me because I know they can do better. They have this great clientele, they have these great ideas, test them. We're seeing athletes back at 8 months now, so I would expect to see him at the start of OTAs. But as we know, we don't really see these athletes get back to their normal self in general, Adrian Peterson aside, until about 18 months after the surgery. It's a chronic injury. That's the issue with it. It's very hard to rest it in the middle of a regular season. So that's why it's so severe and so worrisome. But for him, he seems to be managing it just well. He's off the injury report, which is great news. And, you know, I haven't seen him limping. I've been here every home game. I've never seen him limp, even after a game. So I don't think it's affecting his game too much. Tom Brady last year took a helmet right to the quad.
Yeah.
And he had trouble even getting up onto the podium for the post-game press conference. So, you know, obviously that's not what's going on with Gronk. So this looks a little bit different. And the issue with that is that there's sort of proven facts alongside not so proven facts. And I just didn't see in the book where they discriminated between the two.
Such as?
Such as that Alex Guerrero applying pressure to a muscle as Tom Brady relaxes and expands the muscle is going to teach his neurons to relax when he gets hit by Cam Chancellor.
Gordon Hayward and his foot hanging down there like that. What do you think of that?
Yeah, I screamed when I saw it. You know, I had 3 kids watching the game, so it was a rough injury. I think he'll be sort of either late in the season availability. It's probably safer to wait until next year.
But medically, it's possible he could.
Oh, absolutely, full recovery.
Okay.
I think that question has a medical answer and a non-medical answer, right? The medical answer is yeah, if more than half of the pec tendon was torn in a linebacker, chances are that's something that's going to be a problem during the season. The problem is he was, you know, free agent trying to sign a contract, and that's not a great look when you're in a sling at all your interviews. So, you know, I think it could have gone either way, and I don't think it was wrong to make the decision not to operate if 55% really was the right number.